Today our topic of discussion would be the diseases of external nose and the nasal vestibule. You should be remembering that in the diseases of external nose, the nasal deformities are of prime importance. You should be knowing the names, that saddle nose, hump nose, crooked or a deviated nose, right? This is better understood with the help of these diagrams. The saddle nose is just like this, the saddle of a horse, right? So you should be remembering that this is a saddle nose. This is a hump nose. A hump has been formed. Crooked or deviated nose. The deviated means that the midline dorsum is not in the straight line like this. It is deviated or crooked or S-shaped. This is S-shaped, crooked nose, right? And moving on to the tumors of the external nose, you should be remembering this table. This table is of prime importance, that there are three types of tumor: congenital, benign and malignant. In congenital, there are dermoid cyst, and in dermoid cyst, there are different varieties, right? This is a simple dermoid cyst. As you can see here, it is present in the green, right? This is a dermoid cyst with a sinus. This is a dermoid cyst with a sinus and intracranial invasion, and this is intradural invasion. This thing should be remembered. Other are just the types that you should be remembering, that encephalocele, meningoencephalocele and glioma. In benign, the rhinophyma is of prime importance. As you can see, this is the rhinophyma or a potato tumor. Why do we call it as potato tumor? Because it is just looking like a potato, as you can see this in this particular picture. Why does this occur? This occurs due to the hypertrophy of the sebaceous glands, right? Or in people who are having the long-standing acne or the skin problems, right? It is a pink lobulated mass and it mostly affects men, and it is going to obstruct the breathing, as well as with the passage of time it will obstruct the vision. And the treatment consists of sharp knife or carbon dioxide laser, and it is excised. It is removed, and then the raw area of the skin, skin graft is done, right? In the malignant tumor, you have to remember two things: basal cell carcinoma, squamous cell carcinoma. The basal cell carcinoma equally affects male as well as females, and basal cell carcinoma is the most common malignant tumor. Squamous cell carcinoma is the second most common, right? This is the particular thing that you should be remembering in case of scenarios. It is having a papulopearly nodular appearance, ulcer with rolled edges, right? Ulcer with rolled edges, and it is affecting the tip and the ala of the nose, right? On the other hand, squamous cell carcinoma is infiltrating in nature, and it is going to affect the nose or the clomela, right? And the treatment is the cryosurgery, radiation, surgical excision. The hair, radiotherapy, surgical excision and the plastic repair. This is the same. The differentiating points are this and this, right? Melanoma, this is least common, and this is just superficially spreading, and surgical excision is the case, is the treatment. Moving on to the diseases of nasal vestibule, you should be remembering furuncle or boil. As you all know, that is a furuncle is a small fluid-filled cavity with pus, right? And you know better from microbiology that this is caused by Staphylococcus, Streptococcus, right? Most commonly Staphylococcus aureus, and it can complicate into cellulitis. And more importantly, you should never ever squeeze such furuncles or boils which are present near the lip, near the nose, because otherwise it can enter into the danger area. It can enter into the cavernous sinus, and it can lead to the venous thrombophlebitis, which can be life-threatening, right? So even though it is a minor thing, but if you complicate it by squeezing, it can lead to serious complications, right? Vestibulitis is just diffuse dermatitis of nasal vestibule. It is having two forms: acute form and the chronic form, and stenosis and atresia of the neries. As you can see in this particular picture, this is the stenosis, little bit of opening is here, and this is also the stenosis, kind of more opening, but still it is narrow. So stenosis is actually the narrowing of a tube, and atresia is the abnormal closure, right? For example, this is whole closed, this will be atresia, right? So this is the difference between atresia. It is a complete closure but abnormal, and stenosis is the narrowing. It might be congenital, and the tumors, just the name should be remembered, that nasoalveolar cyst. As you can see that the naso and alveolar related, right? This is a cyst that is being formed, as you can see here, and papilloma and the squamous cell carcinoma are the types. So this brings us to the end of the diseases of external nose and the nasal vestibule. Hope you understand.